So this study represents an analysis of samples from the phase 3 SPARTAN trial. The SPARTAN study randomized 1,207 patients with non-metastatic castrate-resistant prostate cancer to either androgen deprivation therapy plus placebo or androgen deprivation therapy plus apalutamide, which is a next-generation anti-androgen therapy. And the SPARTAN study was positive for its primary endpoint of metastasis-free survival and also positive for all secondary endpoints of the study as well. But even though the SPARTAN study was positive, we hypothesized that there would be subsets of patients that would exhibit more profound responses to apalutamide compared to others. And so what we did was we retrieved samples from 233 patients who had enrolled on the SPARTAN study, and then basically molecularly profiled those samples using the Decipher system. And the Decipher assay is a high-density gene expression array that allows assessment of over 46,000 genes in terms of expression level. And so when we went back to the SPARTAN trial, we were able to group patients into whether they were long-term responders or patients who had early progression of disease on SPARTAN. And what we found was that there were biological signatures enriched in long-term responders for immune cell activation and things like IL-2 activation, which also relate to the immune system, as well as luminal basal signatures. And in particular, patients with luminal disease had better responses to apalutamide than patients with basal disease. And so what this suggests is that there are molecular determinants of response to apalutamide that can be elucidated from profiling patient samples. Now, are these studies ready for prime time today? And the answer is, I think that these samples need to be validated further, but I think that they are certainly thought-provoking. It's quite interesting that